water program manager. So I'm going to tell you all about what that means. But the funny thing about working at a health department is that if in the case of a health emergency, all of our jobs shift to working on that health emergency. So for the past 3 months, I have been working on the COVID response team for the pandemic. Only recently have I gone back to my regular job, and I'm super excited about it. So I'm glad to show all of you all what I'm doing. All right, let's do some lake sampling. Okay, maybe not lake sampling quite yet. It was really loud in that last shot, so I just wanted to explain a few things. I work for the health department in Tacoma, Pierce County. I've worked there for 2 years as the water resources program manager. So a lot of my job is going to lakes, places where people swim or fish, and checking to make sure that those lakes are safe and clean so it won't hurt anybody. What I'm looking at is really public health concerns. A lot of the public health concerns we see include toxic algae, so algae that blooms and releases antitoxins that could get into your body and make you sick. We're also looking for septic systems that might have leaked and put E. coli into the water. That can cause things from swimmer's itch to really nasty nausea. So that's what I'm looking for. I'm not actually most concerned with the quality of the water, but I work with so many people. It's so closely related that water quality is what we talk about a lot. I didn't always work for public health. I come from a water quality background, and my job kind of evolved into looking at water quality for public health. But other jobs in this field are working for conservation districts. I worked for a university to see how they could be greening up their practices, and a lot of it comes down to science. So that's what I'm going to show you today, is a lot of the science behind testing for water quality. I love my job because I get to go out into the field a lot. I'm a program manager, so I have a few other people that work in the field as well, and I work with them to try and make our time really efficient and fun, and I love working with those people. I love getting results and educating people about how they can improve their water quality, whether it's through fixing their septic systems or reducing their fertilizer. We put on a lot of workshops around stuff like that, and I think that's really cool. An everyday piece of my day, well, you're gonna see an everyday day for me of going out into the field and sampling, but a lot of what I do in the office is tracking the data that we collect. So you're gonna see me sample, but when I take it back and I get all the results from the lab, I compile that in a spreadsheet so that we can look year over year if the water is improving or not, and then respond. If it's improving, yay! If it's not improving, we need to decide if we want to go in and educate residents, if we want to take drastic measures to try and correct maybe a like badly broken septic system and try and force that person to fix things. But we need to respond to the bad water quality. So here's what I mean by water quality. Next shot, I'm gonna show you Spanaway Lake out there seeing, do we have toxic algae in this water? So today I'm wearing a mask for 2 reasons. 1, we all need to be safe during COVID, but 2, there's a massive wildfire going on close by, and the smoke has made the air hazardous. So normally we wouldn't be doing field work because of the hazardous air, but today I wanted to show you some sampling, and I'm only going to a couple lakes. This is Lake Spanaway in Spanaway, Washington. This is a really popular hangout. People swim here all the time. It's a very beautiful park. There's a big playground, lots of swimming beaches. This is one of those swimming beaches, and people aren't here today because of the wildfire, but normally they would be. And unfortunately, we have an algal bloom. So what you're looking at right now, we know for certain is algae, but I'm going to take some samples so that I can send it to our environmental health lab to analyze what type of algae it is and if it's toxic. And if it's toxic, we'll put up a sign to warn people. We've known that this is here for a while, so that's why I'm sampling today, so we can keep a steady record of how it's going. Even though people aren't swimming and the signage might not help people today, having the record of toxic algae in this area
is very helpful. So the way I sample, I take a clean container and I dip it right here along the scum, and I'll get a little bit more than that. And once I have as much as I want in this area, I'm going to take a replicate sample so that when we send it to the lab, we can compare samples for quality assurance with the lab to know that their instruments are calibrated correctly, and we would get the same result no matter what. So this stuff is pretty gross. If this is toxic algae, it can make people sick by making their skin feel really itchy. If ingested, especially small things like pets and little kids, it can get really, really sick. It can cause vomiting, it can cause neuro disorders, and there's even been some pet deaths in this area. So we definitely don't want that. That's why we're monitoring it closely for public health. And I'm gonna show you some more sites. All right. So here's a close-up. Super gross. And algae is caused by excess nutrients in the water. Nutrients could be from a failing septic system. They could be too much fertilizer. Anything that would give this algae something to feed on and bloom and do this kind of damage to the lake. Here's some of the signs that we would hang up to warn people not to swim in toxic algae. That's my phone number. People call me if they have any questions. And then because there is toxic algae in this lake, this is an informational sign just telling people about toxic algae. But this is a sign that says, caution, there is an actual bloom. We're not just educating, we're warning people not to get in the water. Yep. I'm gonna sample it. It's gonna be toxic. Check back on your local health department's website. Right. So very bad news for Pierce County, but good news for you, so you can see the worst case situation of what we do. We are here at Ohop Lake, another fantastic lake. This one has a bunch of people that live around it. They love to go boating and fishing. And Ohop doesn't get toxic algae a lot, but unfortunately, it looks like in this long extended summer season, they have had a chance to have a very large toxic algae bloom. So I already took a sample for this one, but there is no advisory on this lake currently. We're gonna wait for the lab to send us those toxic results, but I've been doing this long enough, I'm gonna guess that this is a blooming toxic algae bloom. And everyone on this lake needs warned that if they swim in this, if they eat fish out of this, they could be putting themselves at risk to get really, really sick. And that sucks, but that's why the health department is here. Like I said, this is a lake that these people aren't used to seeing toxic algae, so the type of warning that we do through letters is probably gonna really help prevent some illnesses. And I see little dog leashes around. I especially wouldn't want any little puppies licking out of this water because that could make them very, very sick. So we're gonna go to the next lake, but you get to see a bright green toxic algae bloom. Okay, so I've got some good news, bad news. We are at Clear Lake, and the good news is the lake looks very clear. I don't see any algae. It's so clear that I'm not even gonna sample. I don't think there's anything here. But the bad news is we are still on fire. So this is the last lake of the day. I wanted you to see this beautiful clear water. Normally we have a beautiful view of Mount Rainier. I'll try and drop it in the video, but we are done for the day because it is not safe to be lake sampling anymore. So let's head back to the lab.
Okay, so I dropped off all of those samples with the lab. They're gonna email me back in a couple days to say how the water quality is. I'm gonna guess it's not good, so we're gonna go ahead and get ready to start issuing an advisory for the people who live around the lake, telling them that it's not safe to swim right now. And that's kind of the bummer part of my job. But if we weren't there to issue advisories, sometimes when the algae isn't as present, people don't know that it's icky, and they can get sick. So that's my job, is to warn people. And another thing I'm gonna do is set a meeting with the residents of Ohop Lake, the last one that we visited. They don't get toxic algae a lot. So I'm gonna do a community forum with them and say, what are your questions? Here's what you can do, and stop using fertilizer. If you stopped using fertilizer, the toxic algae would really be broken down a lot. So what I showed you today was just what we were doing this week, was a lot of toxic algae. But don't forget, we also work on septic systems and other risks to public health, especially I never went over drinking water. So some people get their water out of wells. Hello. Working from home is fantastic. And anyways, the people that get their water out of the wells, we test their water too, because they don't have a utility that's constantly checking water. So the health department goes out and checks their water to make sure they're safe. So that is really everything I do in a very small nutshell. Super glad that I got to be part of your class all the way from out here in Washington. I hope you all are safe and doing well in Vermont. And thank you very much, Anna, for putting this together. Have a great day.